We work with the hardest to love, so we work with everyone who's blamed for things that go wrong in society. So drug users, people with mental health needs, parents, migrant families, all the groups that traditionally don't get a first-class service, we try to give them the best service going.
Faye Selvin, Chief Executive of the Big Life Group, talking to me at the Social Enterprise in Healthcare event run by PCC earlier this week in London. Social enterprise is about altruism, but don't be fooled. There is a steeliness to social entrepreneurs because you have to be determined to make it as a social business. Martin Kinsella, Chief Executive of the award-winning P3 charity, explains.
It's always been the case when, if you've been in the third sector, I've been in the third sector tendering into the NHS and local authorities, and I've also been in the NHS tendering services out, but my observation was that we always had to be 3 or 4 times better than the statutory stuff to actually even get into the race. Most social enterprises are actually driven by a sort of ambition to make things as good as they can be, and that, I think, is apparent in the NHS, but it's not universal in the NHS anymore.
Faye Selvin agrees, and she urges starry-eyed idealists to think about what they really want before starting a social business in health.
If you've not got a mission to do things differently, then why aren't you doing that in the NHS? And I think you have to be really motivated to do social enterprise because it's so much harder than being a director or a manager in an NHS body. So my question would be, what's your motivation? And most people I know who are motivated to do social enterprise because they want to make the world different.
Social entrepreneurs don't agree about everything, but they are united around the principle of co-production. That principle is essential in commissioning the right services. Here's Peter Holbrook, Chief Executive of the Social Enterprise Coalition.
And I understand why commissioners commission the way that they do, because they're under enormous pressure and they're not allowed to take risks or make mistakes or ever commission anything that will ever fail. But that leads to stifling of innovation and new models of delivery. So commissioners have to be given the opportunity to do things differently, and they can do things differently if they build upon the intelligence of the end beneficiary and service users and families and carers to actually bring in that kind of grassroots intelligence, which is so vital.
Martin Kinsella echoes that view.
I think co-production in 5 years will be commonplace, that people will be brought together across the range of expertise, including the people, crucially, who use the service, to actually inform the shape, specification of the service. And what's happened in the past is that services have been specified by someone who's got a sort of remote, non-local knowledge, and they've never hit the mark. So we've got an opportunity to make them hit the mark. Again, massive opportunity.
The government's health policy, with its emphasis on local decision-making, centred on patients and led by GPs, sounds like a co-production charter. Peter Holbrook welcomes the idea of localism, but worries about how it will work in practice.
If you look at a GP's training, all the way through their medical training, they are only ever, I suppose, trained in treating of symptoms. And so will they effectively be able to commission services that tackle the drivers that create social inequalities and health inequalities? And that's the fear.
The big challenge is that in order to invest in new and better services, commissioners need the courage to get rid of some of the old ones. The track record of successive governments hasn't been encouraging.
One of the failures of the new money that went in 1999 onwards into the NHS was that there was a tolerance of duplication, if you like. Some excellent new services were put in place, but the old service that was in that place was never taken out. So you sometimes got in a particular town or city 2 or 3 services serving the same need, competing for the same people, and chaos and at great cost, at 3 times the cost necessary to actually do it properly.
But if the NHS hasn't always got it right, it hasn't always got it wrong either. Social enterprises traditionally fill in the gaps left by statutory services, but it doesn't mean they have ambitions to replace them. Faye Selvin.
What we're really good at as a social enterprise is working with people who are not getting a good service. And I think, the NHS is a bureaucracy, but, there's nothing wrong with bureaucracies when you need to deliver a same standard service to a wide range of people across a wide geographical area. And that's really good for Mr. and Mrs. Average. And the work that I think's happened over the last 10 years in transforming the NHS has been remarkable.
Peter Holbrook is hopeful about what the future holds.
And it is the principles of social enterprise, which is around co-production and co-design, not putting the power and the decision-making in the hands of too few, and making sure that there is transparency, which is something that the government promote, that there is accountability, and that there is responsibility. And if we can get those things right, then I think that the revolution that is inevitably going to take place could provide some fantastic outcomes and opportunities.
It's easy to mistake social entrepreneurs for pathological optimists. But if that was all they had going for them, they wouldn't last. Martin Kinsella sees commissioning as a problem we still haven't solved, but after a long career in and around the NHS, he's not about to give up.
There's a big challenge, but let's say what's gone in the past didn't work. I'm for radical change and transformation. Let's make this work.
For Faye Selvin, the key to better services is to do good business in more senses than one.
I would say to our staff, I want you to make a profit. Make a profit because it means you're being efficient. Don't make a profit by running a poor service. Make a profit by being efficient. We can then use that money to pay for things that we're not being contracted to deliver. And the difference between us and a private business is that the profit we make goes back into services. It doesn't go into dividends to shareholders.
Last word to Peter Holbrook, who's impatient with questions about the relevance of social enterprise. The answer, he says, is staring us in the face.
But why now? It's because we have no other options. We can't just keep on pumping public money in because we don't have the public money. So we need a revolution, and this is the best shot we've got of protecting frontline services, staff welfare, and actually keeping a national health service.
Why Now was presented by Julian Patterson. It was an NHS Networks production.